Stem cells are becoming the main treatment for many diseases, to improve many diseases. So one of the examples, we have one of the best rate success are the pulmonary diseases. For the most pulmonary diseases, we are limited because we don't have direct therapy to directly affect on the cause of the pulmonary disease. Mostly we have some therapy which treat consequences, not the cause of disease. One of the reasons why stem cells bring the biggest success rate for the treatment of pulmonary disease is because they directly has effect on the cause of the diseases. If you go on Pubmed, the main source of medical knowledge, and you go on search engine, write example COPD, chronic pulmonary disease and stem cells, or asthma or bronchitis with the stem cells, you will have unlimited number of scientific articles which improves the success of the stem cells application for the pulmonary diseases. Shortly, in my experience, we can say that we have the highest rate of success for the pulmonary disease with the stem cells because we gave them by IV treatment with infusion, and they directly caused the biggest number to the pulse. And because they have the highest concentration, this is one of the reasons why you have extremely high success rates. The definition of the stem cells or function is to replace damage of the tissue and replace dead cells with the new cells. So when they come to the lung, they repair what they have to do. We use stem cells from the fat, we get out of them under local anesthesia, we prepare, it takes 4 hours and give them by IV. We can also activate them with the laser blood irradiation, but this is another story. The most common diseases where we use stem cells for the pulmonary diseases are asthma, bronchitis, COPD, chronic pulmonary disease, pulmonary fibrosis, and post-COVID complication. When we have asthma and bronchitis, we have allergy. Stem cells repair immune system that doesn't attack itself, reduces inflammation, production of inflammatory molecules which damage the lung, repair, and this is the reason why it has so high success rate for asthma and bronchitis. Regarding pulmonary fibrosis and post-COVID reaction, the main problem is that pulms become rigid, hard, they can expand, so we are limited with inspiration, we don't have enough air. So stem cells are at the moment the most known and the most effective treatment which reduces this fibrosis or hardening of the lung tissue. Regarding chronic obstructive pulmonary diseases, the main symptom is that we are out of the air, we don't have enough air, we become easily tired, we also usually have cough, we are coughing very often, but this is not always that way. In the most cases, COPD can be joined with asthma, bronchitis, and emphysema. So we have combination autoimmune diseases, we have allergy, and we have mechanical destruction. The reason why stem cells are one of the best treatment is because they directly affect to stop this inflammation, which is a fallout in the lung. And as we decrease inflammation, the pulms, bronchioli, they don't have constrict, they don't limit the flow of the air. So we repair the lungs. In the most cases, especially for the post-COVID and COPD, we have other systems because the whole body is affected. When we put stem cells, we do not only repair the lungs, we repair the full body. So this is another advantage. So at the moment, the best thing which we can offer are the stem cells for the pulmonary disease. We don't say it's a replacement for the standard therapy, but we can combine it and we can improve the efficiency of existing therapy what we have. So if you have lung diseases, think about the stem cells. In the most cases, stem cells are last step before a lung transplantation. Thank God that now we have powerful weapon which is safe, which is your own, 100% safe, and we can use it if you have any problem regarding lung diseases.